Hello, everybody. Hi, my name is Gail Daffler, and I'm the Prevention Coordinator at Goodwill Easterseals Miami Valley. Welcome to our second podcast for WISE, which means the Wellness Initiative for Senior Education. Thank you so much for tuning into our DATV television show that aired at 3 p.m. With our host from UMADOP, Tamara Cantrell and Michael Mann, as well as our co-worker, Trent Smith. You guys did a fantastic job. We're just really proud to be on our podcast and follow up with some great information. I would love to introduce to you one of my favorite co-workers that I've worked with for a very long time, Miss Adina Wingfield.
Awesome. It is so wonderful to be here, Gail. Again, my name is Adina Wingfield, everyone, prevention specialist with Goodwill Easterseals. Happy to be a part of this wonderful team partnering with UMADOP. And I want to remind our listeners to just catch up on our show every third Tuesday at 3 p.m. Then there's the second Wednesday at 10 p.m. and third Fridays at noon. There's an additional day, Thursdays at 3 p.m., that this will replay. And our podcast today will be connected to DATV and our Goodwill Easterseals Miami Valley page, our Facebook page, in addition to UMADOP's YouTube pages. So this is an awesome day, and I'm just so glad that we are able to share with UMADOP. And UMADOP is a great program that we are working with our partners, Michael Mann and Tamara Cantrell. And we have put together a great system with our WISE program. Again, WISE stands for the Wellness Initiative for Senior Education. So I'm going to tell a little bit more about UMADOP. So UMADOP's history. It stands for the Dayton Urban Minority Alcoholism and Drug Abuse Outreach Program. And UMADOP, they offer alcohol, tobacco, and other drug prevention education for adults, for children, seniors, and also they have a reentry program for ex-offenders, and even a summer camp. In addition, UMADOP offers outpatient treatment services. Individual and group services are available. To reach UMADOP, led by Dr. Marquita Robinson. Again, UMADOP is led by Dr. Marquita Robinson. The number is 937-276-2176. That number again is 937-276-2176. And we hopefully will put that in our chat. We have Justine Bauer, our new coworker, working in our live chat, and hopefully she can get these numbers down for you. Please take time to get a pen and paper and go along with us to collect some information that we love to share with you all today. And I'll turn this back over to Gail to tell about Goodwill's history.
Thank you so much, Adina. And please remember, if you do have any questions or need any information, please let Justine know in the chat. She will gladly connect you with that information. And if we need to wait a day or two to find that information, we will definitely get that to you. I do want to take a minute to talk about Goodwill Easterseals and highlight 3 programs through Goodwill Easterseals Miami Valley. The first one is our prescription medication safety campaign, which is part of our prevention programs at Goodwill. We go out to area pharmacies, physicians' offices, and we give out medication disposal pouches, and we encourage our providers to educate our community about best practices around medication use, disposal, and also storage. And we also give presentations to area groups, whether it's as young as kindergartners and to any age group, about best practices around medication. And Dina, I want to ask you something really, really quick.
Sure.
What is the best place to store your medication?
The best place to store medication is up high in a locked box or a locked container, somewhere up high and out of the way.
Mm-hmm. And that's something, if you have some medication in your home and you're concerned about its safety, and you're looking for a locked box, please let us know at Goodwill Easterseals Miami Valley. My name's Gail. Please give me a call at area code 937-461-4600. 4800. We are giving out lock boxes to people who need medication, their medication stored safely. So you're able to give me a call and let me know that.
Awesome. And so we work for behavioral health, and Dawn Cooksey is the director of behavioral health. And so we're happy to announce that we also have Main Street Recovery Center that is overseen by behavioral health. Our Goodwill Easterseals Main Street Recovery Center provides counseling, diagnostic assessment, and case management for people dealing with mental health or substance abuse issues. The program also offers mental health services for children, as well as individual and group counseling sessions. In addition, we offer psychiatry services, including medication assisted treatment for substance abuse issues. So, again, that is Main Street Recovery Center.
Great. And I want to tell a little bit about our Miracle Clubhouse at Goodwill Easterseals. At the heart of the Miracle Clubhouse is the belief that every member can sufficiently recover from the effects of mental illness to lead a personally satisfying and productive life. Together, the members and staff participate in activities that provide a solid foundation for growth, self-respect, and individual accomplishment. Decision-making and governing involves members and staff working together to develop the clubhouse plans. So every day they work together to check on each other, and to make the clubhouse work together. They also have like a work program that helps some of the members get connected to employment, which is just fantastic. For more information about any of the Goodwill programs, feel free to give us a call at area code 937-461-4800.
And I'm going to speak a little bit more about a couple more programs related to WISE. One program is a senior program that Goodwill Easterseals offers called CSEP for short. And it's the Senior Community Service Employment Program. And that's led by Jean Ritchie. And the Goodwill Easterseals Miami Valley CSEP program provides employment options for mature, talented group of workers with work ethics, enthusiasm, and life experiences that are essential for today's workforce. So by referring to those you serve to our CSEP program, you are offering a chance for those individuals age 55 and older to gain a fresh start with on-the-job training and employment opportunities. In turn, employers gain valuable new employees who bring experience and desire to learn the job. So who's eligible? Let's talk about that. You should be 55 years of age or older. Maybe you've experienced barriers to employment. Maybe there's limited or low income. And of course, you're unemployed at the time. So there's a number to call here, 937-528-6540. That's 937-528-6540 for more information about CSEP. There also is another program on the rise. Since COVID, there were a few programs that we did have to shut down for a moment, but look forward to a Matter of Balance returning in the next couple of months. And Matter of Balance helps older adults to keep their balance and to learn how to work safely at home. Many older adults experience concerns about falling and restrict their activities. A Matter of Balance is an award-winning program designed to manage falls and increase activity levels. So the program emphasizes practical strategies to accomplish personal goals. And so there'll be training and classroom activities, and we're going to just be able to connect with Sharon Mitchell, our program coordinator, for more information. And here's another number for you to write down, 937-528-6359. That's 937-528-6359. For more information about Matter of Balance, contact Sharon Mitchell.
And Miss Adina, I want to talk a little bit about what's going on with COVID-19 in our community.
Oh, yes.
Yeah, so there's a lot of things changing right now, and we just kind of wanted to give some updated information to our listeners. So the current vaccine registrations, there's a few clinics coming up on Thursday, March 18th from 9 a.m. until 5 p.m. at the Dayton Convention Center. You were able to call and schedule your vaccination. Please call the phone number 937-225-6217. And can you tell us about the Friday event, Miss Dina?
Okay, I see that there's Friday, March 19th at the Minority Outreach Clinic. That's again Friday, March 19th at the Minority Outreach Clinic, scheduled from 9 a.m. to 5 p.m., and that's at Bethesda Temple. You know, if you have questions about these locations, again, please take the number to Public Health and ask plenty of questions at 937-225-6217.
Great. We want to go over a little bit about the Greater Dayton RTA because they are just a great resource in our community. They're offering 3 free options to get to the clinics. Option number 1 is when boarding any bus, simply present your appointment registration in print or on your mobile device and or your COVID-19 shot record, or when traveling to a pop-up or walk-up vaccination site, let the driver know that upon boarding.
Awesome. Now here's the second option. It says customers who do not have access to a bus route can still schedule their vaccine trip on RTA's Connect services. To schedule a trip, call 937-425-8300. Reservations can be made 7 days a week between the hours of 8 a.m. and 5 p.m. And same-day reservations will be considered subject to availability. RTA or one of its qualified providers will provide transportation service.
Okay, option number 3 is when traveling to the convention center or the Bethesda Temple sites, you can board a free shuttle at the RTA's downtown transit center. The pickup and drop-off are located on 3rd Street between Main and Jefferson Streets. Service runs when the sites are in operation. So service begins 30 minutes before the site opens and will run until the last customer is transported back.
That's awesome information. And we can find all of these things again on the websites and through contacting Public Health.
And I want to remind our listeners that if they're considering the vaccination and have many questions, another person that they can talk to is their medical physician. And ask, especially if you have medical conditions, to see if this is a good option for you, or if you're taking certain medications, just to make sure there's no interactions with the medications that you're taking.
Absolutely. And we also just want to make sure we're continuing to stay safe, staying masked up, and keeping social distance. It is very important to keep our hands washed and continue. As things get better, they're getting better because we're doing what we're supposed to do. We're doing what the governor has asked us to do and trying to help each other out. So everybody, thanks for doing a great job. And we're so excited about this warmer weather as well, right? It's been great outside, hasn't it?
It's been super outside, and just to see that there's some events that are going on outside, to see them on the schedules, it just makes my heart feel like uplifted, and I'm really looking forward to being able to go out and do some more activities, Miss Dina.
Mm-hmm. So we hope everyone is feeling pretty good, and we're going to switch over to our topic for today. What is our topic, Gail?
Oh my goodness, our topic for today is aging sensitivity. Now that could be a lot of different things, couldn't it, Dina?
It can. It can. And we're just kind of exploring, today on the show they explored what it meant to age in our larger society and for each of us personally. So there was a lot of different things that we went over today about how our bodies change even as we age. And so no one's exempt from that. We're definitely all aging. And so it was a great show, and I hope you all can catch up on that at another day.
Right, and that's something that you can definitely watch again on a rerun on DATV. And I'll go over those times again here really quickly. They are every second Wednesday at 10 p.m., every third Friday at 12 p.m., and Thursdays at 3 p.m. You can also catch the or the TV show on the YouTube channel from DATV. So they have that on there, and you're able to watch that at any time at your leisure, which is really nice, right, Dina?
That's right. So you had a subtopic here, Gail, that says how you asked how do we age here with sophistication and elegance. I really like that.
I love that because, like, as we get older, how can we be genuine to ourselves, and how can we enjoy life to make it the best life that we can?
Absolutely. Life is just beginning, a different form of it as we age. We in this program, we are encouraging positive attitudes and thriving as you age. It's okay to accept change. That's what I'm learning. Just learning to manage change. Even those aches and pains, they come with the territory, but there are some things we're going to learn in our classes along the way to help combat some of that. We don't have to live with pain all the time, so we'll share some of that as we go along.
Absolutely. Should we look at, like, recapping last week?
Sure.
Great. So last week we looked at understanding changes associated with aging, and thinking about, like, what Miss Dina said, talking about those changes, because sometimes that's really, really tough to get through.
Oh, yes.
And then we looked at aging is individualized, because what could happen to one person might not happen to the next. And I know sometimes I look at a person, I'm like, why can't my life be like that? Why do they get around a lot easier than me? Or, why am I challenged in this area and they're not? So, understanding that sometimes there's things that are very individualized.
Definitely. Our behaviors and attitudes toward health and wellness are a big part of it. And so I'm glad that those who are joining us, we're joining into a movement about health and wellness, and finding the good things that we can do to challenge ourselves. Even though we may not have done it before, we can start. You can start new things at any time. So I'm excited about that.
Today is the day.
Today is the day. Right. That's true. Our lesson last week, we had a trivia lesson, and it got a little heavy. We talked about number one causes of death. The month of February is Heart Health Awareness Month, especially for women, with heart disease being a number one cause of death for many women. But in the world, the number one cause of death for community members 55 and above is heart disease. So we've decided that Heart Awareness Month is every month. Every month we want to challenge everyone to pay attention to some of the risks of our heart health that associated with heart health. And can you name some of those risks, Gail?
Absolutely. Number one, whenever I think about heart health, is smoking. That's just such a high risk with your heart, whether that's smoking tobacco or vaping. Making sure that you make great decisions around that.
Absolutely. Yeah. And with smoking, it's a tough one. That's a tough one for people to discontinue. But there are programs, there's wellness options to try to stop doing that. But we're not judging anyone here. Again, this is a judgment-free zone, but we do want everyone to experience a healthier life.
Right. Can you think of anything else that would help out with the heart health, Miss Dina?
Our diet. Oh my goodness. I love Big Macs. I know many people love to eat all of the fast food, but you know what? It's time to cut back. It's time for more greens and healthier food. In addition to that, let's switch out some of that pop, that Coca-Cola, or, there's the debate, Coca-Cola or Pepsi. Which one is it? I'm not even going to go there, but there's just certain pops we like, RC, whatever the cola is. There's different things that we can do. We can drink more water. And I'll just say what I've said before. Drinking half of our body weight in ounces per day is the way to go.
The water is just such a great, healthy way. And it helps out with, like, say, stress reduction as well. It helps us in so many ways, Dina. And what just a great way, what a great first step just to become healthier is just to drink a bottle of water.
Oh, yes.
So when I think about heart health, I think about alcohol consumption too, and that it can be just as simple as just making sure that we only have one serving of alcohol. Sometimes where we're out with our friends or we're having a dinner, we might have 2 drinks with our meal or 3 drinks. So, making sure that we limit that and, maintain that. So maybe having just one glass of red wine with our meal instead of 2 or 3. So that's a huge way that we can make sure our heart's healthier.
Absolutely. And the pandemic has brought on a lot of people drinking more. You're at home more. A lot of stressors are going on. Maybe grandparents are keeping the grandkids. Are you homeschooling some of them? There may be a little bit of things that you say, oh, I might do a little more of that. But we are here to bring you some other options, some alternatives to combat that desire to do a little more of that, because we want everyone to stay safe and healthy. So another part of heart health, we're just so glad that people are looking more into really moving forward with less alcohol consumption.
So I want to ask the viewers if they've made any changes since our last show. What are you doing right now to promote health in your life? Are you getting up and moving around more? Are you having more conversations with your neighbors? Are you are you working with your medical team more? Or have you decided I'm gonna have a few vegetables during this meal? What are you doing? Are you more creative? So what are some of those steps that you're taking to be proactive with your life?
Well, I know what I changed since last show. I definitely took more water in. It's very important. And I decided, I said earlier, I joined the gym. I decided to actually go to that gym. Because don't we often sign up for things and not participate? That's a strange notion, but I know I'm not alone, right? So I decided to actually go. So I'm going to add myself to my calendar. I encourage everyone to do a little self-care and add yourself to your schedule so that you can add in water intake and healthy diet and exercise into that daily plan.
I've been exercising a little bit more. I love getting out and walking, especially I have dogs, so I love to get out and walk with them. So, it's getting a little bit warmer. We're able to get out and move around and just to have interaction, with our environment, which is wonderful. I love breathing in the fresh air while I'm on those walks. So that's one thing that I'm going to continue and hopefully be able to be outside more. I just love it. The sunshine on my skin just feels so good.
Awesome.
So what areas do we need to keep an eye on to help us to be healthier? So in the last session, we did talk about depression. And we talked about just isolation, especially with COVID-19. And what can we do just to kind of feel better around those areas? Because I think we're all challenged, aren't we, in those areas, Miss Dina?
Absolutely. And your mental health matters. It is okay to feel, so there's grief going on. There's a lot of loss and different things happening around us. It may not be directly in our face, but it's all around us. And so we have empathy for those who are suffering. So it's great to acknowledge our feelings. And if we need some help, remember there's some special numbers we said earlier. Go ahead and get some help. It may be therapy. It may just be going to find a friend and to ease your mind. But it's okay to feel sad sometimes, but we don't want to stay there. So we have to find what brings us joy. Want to tell me what brings you joy, Gail?
Oh my God. Oh, I have lots of things that bring me joy. But, when I think about, say, all the isolation, I think about just having those phone calls with friends that I haven't been able to see in such a long time, haven't been able to spend time with, or the family members that I haven't been able to talk to see, in person. So making sure I take that time and call them and talk to them, check in on them, that's been a huge thing for me. brings me lots of joy. What's something that brings you joy?
Oh my goodness, I love my pets.
Yes.
Taking care of my animals, having something to take care of, um, that loves you back. Just they're so sweet. I have several puppies that were born, and anyway, it's just been really nice to take care of my animals and enjoy their company. So we have to do what works best for us. If you like to do art, do things that make you happy.
Exactly. And sometimes just when I think about just checking in on my neighbors, that right there is having those like conversations from the porch and the sidewalk. How are you doing, neighbor? Just getting to know people a little bit more, because there's so much isolation right now, and having that disconnect affects our well-being. So I think that be really creative about that. And I love all the schools are having parades to, in cars, so that the young people, they aren't missing out on different activities. Just, and I actually, one of our coworkers had a parade for her husband that turned 70 years old. So he was out in the front yard, Dina, and then the people who wanted to wish him a happy birthday drove by and dropped off presents.
Oh, that's nice.
And I'm like, what a creative way to say happy birthday, even and to stay safe.
That's right. This pandemic does not have to end our connection to one another. We can find creative ways to connect. I love that you said talk across the street, or just asking one another what we need. Giving always helps me to feel better when I'm feeling down. So that's a great way. Socialization and connection.
And thinking about how we can use technology to keep ourselves, like, say, connected, whether that's learning how to use Zoom, learning how to use FaceTime on Messenger on Facebook. That's something, I hope my mom's on the recording here, but she has used FaceTime. I'm so proud of her.
Oh, yes.
She's 84 years old, and she knows how to use that, and, like, has made different phone calls that way so she could see people. What a great gift to have. And I love that I love people are open. I know I'm opening up to different technology, and we're learning things, and it feels great when we do that, doesn't it, Dina?
It is very rewarding. Another thing is, maybe we don't want to go to the grocery store right now, but guess what? You can learn to order groceries online. And if it's too much for some that say, I don't want to bother with technology, hopefully you have some neighbors or a friend to ask and say, can you order this for me and help me out? That way you can just pick up your groceries curbside and go ahead and have those quickly done for you, without a lot of hassle. So we asked about that, about family members helping you, about friends. And if you're struggling with help, reach out to community service centers like the Miracle Clubhouse. There's connection there with people that can help you to engage with groups of people and develop new friendships.
Thank you so much. And I know that that's been a big challenge for people. I think sometimes we don't want to ask for help. We are very, very, very proud, and like sometimes it's tough, but I see people opening up to this and welcoming it. So what a great gift to have.
Absolutely. Absolutely. So aging in a new millennium, what is that like?
Let me tell you, Dina.
Okay,
Let me tell you all about it.
Tell me all about it.
So when we look at that, like age, especially during the pandemic, oh my goodness, I feel like I've gained 10 or 15 years this pandemic.
Okay.
But I think I've gained so much awareness of our connections in our community. I've gained a lot of awareness about how kind people are, and like you said, about all the giving that's gone on in our community. It is amazing to see that, and that's something that and just being open to all the changes associated with aging. Huge step.
Yeah, embracing the change, actually. That's a tough part for a lot of people. Understanding the value of time, acknowledging that aging is not always easy, but it's worth the experience that we learn along the way. And we're just learning about the beauty of love, life, family, and friendship. This pandemic, if nothing else, has helped lots of people to learn what matters most. What do we really care about? You know, we can't get all fashioned up and go a whole lot of places. So all those clothes I had, I'm like, where do I wear? Where do I wear this to? So a lot of changes have happened with that even. So I hope some people can relate, and go ahead and put that in the chat about what things do you relate about that have helped you to be more aware of just change, and what has this done in a positive way. I mean, as far as what all of this major change has occurred, what's happened.
And then what are some things that like Adina said, what are some things that are important to you? Is it having fun? Is it that connection with our family? You know, is it valuing, like, say, principles? So looking into ourselves and figuring out what we need so that we can proceed and that we can find that happiness that we also well deserve. The other part is, where's that fun? You know, like this past year has not been very fun.
Oh,
It
goodness.
has been, felt like a big burden. And so I know during the TV show, somebody said, having fun.
Yes.
Let's all have fun this year. Let's all, like, lighten up and have a good time, because that is something that I think we all deserve that.
I love to see people just dancing, you know, just do a video of you dancing and having a good time to your favorite music. It is just time to really just kind of let your hair down and relax. It's been pretty stressful, but things are getting better. They're getting better. We just need to stay active and enjoy our lives. So there's a question here about some ways to manage isolation in this time of the pandemic. We kind of went over that, but isolation is major. Some of us may be afraid to go outside. I encourage everyone to please step outside and get fresh air daily. You may not want to go a lot of places, but if you do, just remember, keep your hands washed and mask up. Make sure you wear your mask. And if you want a double mask, that's fine too. And also try to get your vaccination if you feel comfortable doing that.
I've noticed so many people in the parks, walking in the neighborhoods with their mask on. And that I think that helps just to bring, like, a sense of, like, safety. So thank you to all of our community members who are doing that, practicing those safety steps, because that helps out everyone to feel more safe, and for the people who may be concerned about going out in the community, that helps them to see that people are willing to practice those safety steps. Dina, I'm looking at this, and I love this question. What are some ways to have fun, though? Like, what are some things that we can do just to promote, like, being lighthearted and having a good time, but also being safe?
Oh my goodness. You know, the internet, once again, there's YouTube, there's a lot of things. Maybe you enjoy line dancing. You can pull up a line dance of your favorite video and dance along to that. There's exercise videos, just lots of things we can look at. Again, you mentioned FaceTime. Get on a call with a group of family members and play a family game. You can do it virtually. It's okay. Get a deck of cards, try to play it, or do some Pictionary. You know, some things we can do like that. There's so much, but we have to get creative. And one of my favorite things to do, a lot of people say, I can't do it, but paint. Draw pictures and paint. It is so relaxing, and you won't regret it. Now, some people just flat out say, no, I'm not an artist. It's not me. But give it a try. Try new things, and that's how we learn to have fun.
I love painting, especially when you have, like, the deep sea music. Go to YouTube, look for the deep sea music. It's very relaxing. And sometimes there's a video of, like, dolphins connected to it. So it's like this beautiful scenery from the sea. And you're painting, and it's almost like you get lost in the painting, right, Dina?
Absolutely.
And you don't even know that you're painting once you really get into it. And then it's just all about creating and being in the moment. It's wonderful. It just brings a sense of relief. It's such a great stress reducer.
Definitely. And crossword puzzles, you know, those are underrated, but those get fun, and just trivia. In addition to keeping our minds going, reading and different things like that. Those are the fun things, and some things that are lost art because of all the technology. So some of our fun is, what is my technology detox? What am I going to get away from because I've had too much of a thing? And some of it is the reverse, maybe to learn more technology. So it depends on where you are in your process, but we are advocating for you to have fun. Lots of it.
In Dayton Public Library, they're currently open and they're practicing really great measures to keep us all safe, and sanitizing, you know, all the books that go out. So that's something that you can go to any of their locations and find really great reading for yourself.
So next up, we want to go over some agency highlights and some things that we're doing to help our community cope with the COVID-19 and various things. We have the Miami Valley Warm Line. Our number at the Miami Valley Warm Line is 937-528-7777. And that line is open Monday through Friday, 11 a.m. to 7 p.m. You can call this number if you're dealing with stress or anxiety, various things. And we help to provide resources and referrals if you're dealing with, if you're battling with mental health, alcohol, or addiction. Please contact our warm line at 937-528-7777.
Thank you, Miss Adina. I want to talk a little bit about Oak Street Health. They just opened up back in August of this past year, and they're located at 1431 Wayne Avenue in Dayton, Ohio. They have an on-site care team that specializes in internal medicine, family medicine, senior care, preventative medicine, and geriatric medicine. They invite you to connect with their team of nurse practitioners, primary care physicians, and doctors through your choice of an in-person, phone, or video visit. I love that. I love those options. So you get to kind of let them know what you're comfortable with. Their team can provide you with rides to and from the Oak Street Health Walnut Hills location. I love that. They do have to be in the right service area, but that is wonderful that they're able to help out with that. This location welcomes patients who speak English and Spanish via their dedicated multilingual care team. You can talk with one of their internal medicine or geriatric doctors for a tailored approach to primary care. They're trusted general practitioners and local doctors at the Oak Street Health Walnut Hills location accept Medicare, Medicare Advantage, Humana, and other insurance through your Medicare and Medicare Advantage benefits, social services, and other healthcare resources. The Oak Street Health location is in the 45410 area code in Dayton, Ohio. Same day and next day appointments are available at this location with minimal waits and times.
Awesome.
You can call them for more information at area code 937-660-3149.
Wow, that's an awesome resource, Oak Street Health of Walnut Hills. We also have the Area Agency on Aging, a very optimal resource for people. Help comes in many forms. If you need assistance, they say contact them. They start by listening to your story. And from there, they think of ways to make your day easier, customizing a plan that's right for you, and delivering services that give you the help you need to stay as independent as possible. Please give them a call. They have a number for you to call to contact 223-HELP. That's 223-HELP, or 800-258-7277. There's a lot of information we're giving you today, but again, you'll be able to watch the replay here. And so we'll share that at the end of our podcast so that you can replay this if you need to hear more. But Area Agency on Agency also has several wellness programs. I see Healthy You that offers 3 workshops about chronic disease, diabetes, and chronic pain. Many of us deal with chronic pain, and so looks like a great program. And it provides proven tools to help participants better self-manage chronic conditions. There's also the Aging Mastery Program that includes 10 sessions presented by experts that focus on managing health. So there's so much out here, right, and just many, many resources. But we wanted to mention the Area Agency on Aging as one of our highlights today.
Absolutely. They also have a Healthy You For at-home diabetes, they have a phone discussion group. Um, and also a Healthy You at Home online workshop for chronic disease. So please give them a call and learn more about their services. And their phone number again is area code 937-223-HELP. So, Dina, let's go over a little bit about some protective factors that we can practice every day in our lives. So, especially around, like, say, just our mental well-being and our physical well-being. So I really wanted to talk a little bit about, like, what social isolation does to us.
Okay.
And a lot of, like, we're looking at, like, all this isolation and loneliness that we're dealing with, especially around COVID-19. It was already something I think our community was dealing with because there's just been so many changes around how we communicate, how we interact with each other. And I just think the COVID-19 has just really amplified everything.
Very true.
And so when we look at this, the stress of being lonely, like that amplifies our mental well-being if we have a condition. So making sure we get connected to great services, and that we're connected to our community members, our family members, because even though sometimes it might be difficult to ask for that help, it really helps out our health and well-being.
Absolutely.
So the social engagement is huge too. So making sure that we stay involved and looking at our groups that we can become involved with, whether that's, like, say, a church group. It could be, like, say, a service program. It could be something even online. But thinking about, like, say, I know I'm involved with a couple of, like, say, service groups. I'm on a couple committees, and I have totally missed them this year. And they're connected to arts and crafts. And so I love my arts and crafts, and like, I have very much missed interacting with my committee members and making events happen here in the Dayton area. And that's been a big loss for me. And that's something where, making sure that we help each other out and we get connected to more things. Can you think of some other ways people can become, better connected?
Absolutely. I'm sorry to hear that that's been hard for you. I know it's been hard for a lot of people, but one thing I would suggest is go ahead and look to the future with goal setting. Go ahead and plan those things about when we're getting together next. Maybe it's in the next 90 days. We are traveling. We're going to do something. Maybe it's not too far out, but making plans is definitely going to help to open our minds to get really excited about what's coming. So as we kind of get to finding about things that make us feel better and reducing risk and intervention with isolation, there's some things that we can do to stay more healthy. And one of these things, we can stay more physically active, right? We can reduce and manage our cardiovascular disease risk factors, including hypertension, diabetes, and smoking. We can regularly discuss and review our health conditions and medications that might influence our mental health with the healthcare professional. Make sure you do that. Have great conversations with your doctor. Be socially and intellectually engaged and engage in lifelong learning. We talked about this today. It's so wonderful. Get adequate sleep. Oh my goodness. Do you get enough sleep, Gail?
Sometimes I don't get enough sleep, and I can tell when it affects me. But sleep is such a huge thing, and it's one of the easiest things that we can include in our lives to feel better, whether that's, to feel healthier, to feel more socially connected, to reduce stress.
Absolutely. Take steps to avoid the risk of cognitive changes due to delirium if hospitalized, and carefully evaluate products advertised to consumers to improve cognitive health, such as medications and nutritional documents. But we really, when we deal with all of these things, we just need to make sure that we understand what the doctor said. Really, really make sure you have great conversations with your doctor and let them spend time with you. Don't get rushed, even if it's on telehealth. take time and have your questions written down, right? We want people to write down their questions and talk about those new aches and pains. Even make sure you talk about what's feeling better because maybe we can get off of some of that medicine. So I want to go back to you, Gail, with that.
Well, and also there's really great outlines for questions from takechargeohio.com. That is they have questions like, why am I taking this medication? Will it have any drug interactions with other medications that I'm taking? Is this something that I can become addicted to? Those are just some really great questions that we want to ask our physician, because our health and well-being, that we need to be proactive with that. We need to advocate for ourselves, and we need to search for the best solutions for ourselves. So making sure that we ask those questions and having those conversations. And if you need a longer conversation with your physician, letting them know that, so that maybe they could set aside some more time, or maybe schedule another time to discuss that with you. Another person that's great to talk to, though, is that pharmacist. Your pharmacy team can answer those questions for you as well and give you the information that you so well deserve, because one thing that I know, that working with this team, we're all advocates, and we want to advocate for ourselves and for our family members.
Absolutely. I'm glad you mentioned that because each week we're going to remind everyone about our medication disposal pouch program. And if you need some medication disposal pouches, how can they get those, Gail?
Absolutely. Thank you, Dina. They can call at Goodwill Easterseals Miami Valley, and we can make sure that they get a few. So what we encourage everybody to do is to go through your house, see what medications you currently have, and see what medications you're no longer using out of that. Sometimes we have things and nooks and crannies in our house, and we don't even know that they're there. So go through your whole house, and that medication you no longer use, either take that to one of the many drug drop box sites here in Montgomery County. Most of our police departments have them on site. Most of our hospitals have them in their pharmacy, and we also have additional locations at some of the pharmacies, whether that's CVS or some of the other pharmacies. So please let us know so we can connect you with that information. But if you want a medication pouch, please give us a call at Goodwill Easterseals. Ask for me, Gail Daffler. The telephone number is area code 937-461-4800. Okay, and so we are going to go to some of our closing remarks here. So Dina, let's go over let's review some of our information that we went over and encourage people to contact our great resources. The first resource that I want to make sure to remind our listeners and our viewers to contact is public health. If you have any questions about COVID-19, or if you have any questions about where the vaccination sites are, their phone number again is area code 937-225-6217. Again, that's area code 937-225-6217.
And you all have been so great today. We want to thank you all for tuning in and listening to us. We will be back next month, right?
Absolutely.
Every third Tuesday up through July. And we'll be talking to you about some wonderful topics. Our next lesson will be on cultural diversity. So we're just going to have a fun time dealing with that and storytelling. So we are thankful for you all today. And we're going to sign off and say thank you very much and be well, right?
Thank you so much, everybody. We have had a fantastic time with this podcast. This is my first podcast, so this is a great time. So thank you for listening.